Hello and welcome. Thank you for joining Central Vermont Medical Center's virtual joint class. We're so excited that you elected to come to CVMC for your total joint surgery. In a moment, you will be hearing from my colleagues involved with rehab, care management, and dietary about some of the things to expect as you embark upon your journey through your total joint experience. We hope that we answer your questions. And if you have any further additional questions, let your surgeon know, and we can certainly give you a call and touch base with you individually as necessary. Thanks again.
Rehabilitation for your total joint surgery starts now. By preparing ahead of time, you can improve your chances of a successful recovery and quicker return to the activities you'd like to be able to do. You'll want to take a look around your home for any challenges or obstacles with regard to mobility. For instance, if you have stairs, make sure there are sturdy railings on both sides and consider making the downstairs set up for sleeping if possible for the first few days after surgery if needed. Remove any throw rugs and clear pathways of clutter or objects. Keep in mind that you'll most likely be using a device such as a walker or crutches that could catch on such a rug. Consider furniture heights, such as your bed, your favorite chair, the toilet seat. If you have any difficulty now getting on and off of surfaces, you may still find it challenging right after surgery. The toilet is usually one of the lowest surfaces in the house, but luckily this is an easy fix using such things as a toilet seat riser or a commode placed over the toilet to increase the height. We'll talk a little later about where you can obtain this type of equipment. It is helpful to identify someone in the community as your support person. This may be a family member, a friend, or a neighbor. You will not be able to drive right away, and it will have to arrange alternative transportation. Make sure you have enough groceries, and you may want to prepare food ahead of time that can be easily frozen and reheated later. You'll want to stay active. Continue as able with any exercise routine that you do or have been shown by a physical therapist. Familiarize yourself with the exercises provided in the booklet. In the hospital, you will be taught bed exercises right away and possibly others. Do not become overwhelmed with the amount in the booklet. These are the exercises you'll be doing for the entire course of your joint rehab. Equipment. Some of you may know someone who has had this type of surgery before, or knows someone who knows someone, and it doesn't hurt to ask around. See if anyone has leftover equipment lying around or in a closet. Some commonly needed equipment after joint replacement surgery are walkers, crutches, toilet seats, shower seats, reachers, grabbers, long-handled devices such as shoehorns or sock aids. Your local senior activity center or thrift store may also have these items for free or low cost. Places such as Wayward Wheels in Montpelier loan out this type of equipment for free to be returned when no longer needed. Health insurance companies will usually cover most of the cost of an assistive device such as a walker or crutches, but not usually any bathroom equipment or personal care equipment. See your booklet for local vendor options. Rehabilitation in the hospital. After surgery, you will be moved to a recovery room and be monitored by nursing as you wake up and recover from your surgery. Later on that same day, you will be assisted by either the nurse or the physical therapist in getting up from the bed into a chair and maybe even take a couple of steps. Depending on what was discussed ahead of time with your surgeon and how you are recovering that day, you may be able to discharge the same day as your surgery. If you need to stay overnight in the hospital, you will be seen by physical therapy to work on getting in and out of bed, on and off surfaces, walking, and learning exercises. The physical therapist will also determine which assistive device you need when you leave the hospital, and together with the care manager will assist you in obtaining prior to leaving. You will also be seen by an occupational therapist during your stay. The occupational therapist will work with you on bathing, dressing, toileting, and determine if you have any equipment needs that will help you complete your activities of daily living. Rehabilitation after discharge. Your therapy will continue after you leave the hospital for optimal recovery with your new joint. Usually, patients will return home with supports, such as home health, also called visiting nurses. This will be initiated in the hospital, and the agency you choose will contact you to set up appointments in your home once you are discharged. You may, however, be able to go directly to an outpatient therapy clinic after discharge to continue your rehab. In rare situations, returning home alone directly from the hospital is not a safe or ideal option, and a short stay at an inpatient rehab facility may be recommended. Your care manager is a key person in supporting you with your discharge planning while here at the hospital.
Hello, my name is Rose Pelchuk. I'm here to share with you some important nutrition information as you prepare for your upcoming surgery. It's important that you have a healthy diet before your surgery to make sure that you're in the best physical shape you can be in prior to coming in for your surgery. Healthy eating includes a good variety in your diet each and every day. We encourage people to make sure that they have adequate amounts of protein. Protein is the building blocks of cells. It also helps to promote wound healing and fight infection. The things that are high in protein are primarily everything in the meat group: meat, chicken, fish, eggs, nuts, seeds, the legume family, which are beans and peas, and of course, dairy products. It's important for you to have 3 good servings of protein-rich foods each and every day. Dairy products are high in calcium and vitamin D, which are also essential nutrients to help keep your bones good and strong. We encourage people to have 3 dairy servings per day. 1 dairy serving is equal to 8 ounces of milk, or 1 to 1.5 ounces of cheese, or 1 cup of yogurt. Fiber and fluids are very important as well. The things that are high in fiber are fruits, vegetables, and whole grains. As you increase the amount of fiber in your diet, make sure that you also increase the amount of fluid in your diet. Fiber aids in digestion as well. Some very good sources of fiber are bran cereals, and we encourage people to include them in your daily intake. If you've recently had a decreased appetite or lost some weight, you might want to consider having some healthy snacks in between your meals. This can just make sure that you are meeting your nutrient needs, and again, so that you're in the best shape physically that you can be in prior to your surgery. So in general, it's just really important for you to eat whole foods containing all of the food groups to meet your nutritional needs. You can always refer to the Dietary Guidelines for Americans as a reference. Some tips as you're planning your surgery: you can prepare some home-cooked meals and freeze them so that when you get home from the hospital, you'll be able to have some of your own nice home-cooked meals. Perhaps a pot of chicken soup, that's always good. You might want to make sure you have things like yogurt or applesauce, ginger ale, those kinds of things in the house you can have easy access to, and again, they can help you in your recovery. If you have any other questions, we certainly encourage you to discuss them with your doctor. Thank you for your time, and we wish you well.
Hi, my name's Amy. I'm one of the nurse case managers here at Central Medical Center. Just wanted to go over a few things regarding your upcoming total joint surgery. The day before your surgery, the same day nurse will be calling to go over the instructions to prepare for your surgery. You'll be instructed what time your surgery will be and time you need to be at CVMC. The nurse will instruct you to take nothing by mouth after midnight and what medications you should or you should not take. You'll come into the hospital, you'll come through the main entrance for your registration, and they'll just confirm your insurance and ask you a few questions. You'll then be taken to the same day surgery where the nurse will confirm your name, date of birth, and confirm what joint you're scheduled for surgery for. When you're set up, you will change out of your clothes and put on a hospital gown. The nurse will provide you a bag for your personal belongings for safekeeping. An IV will be started to run fluids. You may have an antibiotic through the IV or prior to your surgery orally. Once the nurse has prepped you for surgery, the surgeon will see you to go over the procedure with you. You will have oxygen applied, Anesthesia and narcotics slow down your breathing. A urine catheter placed in your bladder will be inserted once you're under anesthesia. Once the surgery is finished and complete, the surgeon will apply a dressing to your incision and apply ice packs. Your surgery should take approximately 2 to 3 hours. When you come out of surgery, you'll be coming into the recovery room where you're going to be closely monitored while you're coming out of anesthesia. Your vital signs are stable. You'll be taken to your room. You have hooked to your bed, you have hooked bed-Betadine boots to bilateral legs. The Betadine boots will be used whenever you're in bed. At the discretion of the surgeon, sometimes compression stockings are applied. You'll be provided 2 usable ice packs with sleeves. Nursing to apply and remove every 30 minutes for the first 48 to 72 hours. You'll be able to take home the ice packs when you're discharged. Due to your surgery, you're not moving around much. This puts you at a high risk for blood clot. Betadine boots inflate in and out, massaging your legs for circulating your blood to your legs and back to your heart. It will be anticipated you'll have injections of Lovenox for a short period of time. Lovenox is an anticoagulant to thin your blood so no blood clots can form. Once you've transitioned out of the recovery room, you'll be taken to your room, get settled. At this time, once you have settled, you'll see the PT/OT possibly on the same day or next, depending on what time you have your surgery. It's important getting up and moving as soon as possible to help with pain. You'll be provided an incentive spirometer to encourage deep breathing. The goal is at least 10 times an hour. Surgeon will next day will change the dressing, and then daily the nurse. Most surgeons use silver dressings that don't need changes. Nursing, a surgeon, the PT, the OT will be monitoring closely your pain. They'll be asking you a pain scale, from 1 being the lowest pain and 10 being the highest and worst. There are faces showing expressions to help put in a score to your pain if you're having a good time putting a number to that pain. You will have IV pain medication when you first come out of surgery. Your IV narcotics will transition to oral for discharge. It is important to have your pain controlled for discharge. You won't want to have your pain level to be over a 3 or 4. The urine catheter placed in your bladder is removed the next day to avoid infection. Oxygen anticipate to be not needed when you're out of anesthesia and your O2 stats are being stable. IV fluids anticipate to be discontinued when you have a good intake. Your fluid intake will be closely monitored as well as your output. When IV fluids have stopped, your IV will not be pulled out the day before. You'll have labs drawn daily to monitor blood count. It is normal to have the blood count to be a little bit lower the next day. The blood loss from your surgery is minimum and you're able to replenish quickly. If not possibly, you may have blood transfusion. This hardly ever unlikely happens. At this time, when you're more stable and alert, and you've worked with your PT/OT, the care management team will come and see you. The purpose of the care management team is a function of a Central Vermont hospital collaborative process that assesses, plans, implements, coordinates, monitors, and evaluates options and services to meet individuals' health care needs through communication and available resources to promote quality, cost-effective outcomes. Care management processes and initiates are carried out in a collaborative way with nursing and the medical staff. Care management will do an initial care management screen. It will verify your demographics, your primary care physician, and your insurance, making sure that all that information is correct. Care management will establish a baseline on how you're doing physically and socially prior to your admission. Durable equipment will be go over of what you do have at home. Example, walkers, cane, crutches, wheelchairs, commodes, grab bars, shower seats, BiPAP, CPAP. Do you have oxygen usually at home? All these will be verified with you at this time. Care management will go over what home health services are available. Do you live alone? How many levels is your home? Care management's initial screen is to establish a baseline for potential needs at discharge. The home health services are two home health services in this area. There is Central Vermont Home Health and Biota. Central Vermont Home Health has a nurse liaison, Sue Caldavera, who will be then following with your discharge if you happen to choose the Central Vermont Home Health. Biota is out of Burlington, Vermont, who also have areas that are covered here. If home health is being recommended, care management will ask you which home health services you would like care management to send the referral to. Depending on how you're getting around after surgery, outpatient rehab could possibly be recommended instead of any home health services. However, most generally patients start with home health services, then home health sets them out with outpatient services. There's being less percentage of knee and total hip replacements requiring inpatient rehab. However, it is being recommended care management will assist with referrals to the local facilities like Berry Gardens, that used to be formerly known as Rome Court, Berlin Health and Rehab, that is now Berlin Meadows, and then there's Woodridge. The referrals will be sent with your demographics and your insurance for those clinics, those facilities to check out the insurance coverage and the clinical to assess to be able to make sure that they can meet the level of your needs. The facilities then will notify care management they can offer a bed, or if they're not able to, care management will go over the bed offers to confirm which bed offer will be accepted. Case management assesses with facilities with patients' insurances to cover for the rehab stay. However, we're seeing less of skilled nursing rehabs. People are more going home, having the home health services. The day of your discharge, the surgeon will discuss discharge with you and answer any of the questions you may have. The surgeon then will put in your discharge orders. Discharge orders is a process that can take anywhere between 1 to 3 hours to complete. You'll be medically ready for discharge when you've had good pain control on oral medications, able to keep fluid and oral intake, and a safe discharge plan. It depends on how you're recovering, how many days you will be in the hospital. It could be the same day that you're discharged, or it could be the next 1 to 2 days. Care management will confirm your discharge and confirm your ride home. If there's any new medications ordered at discharge, care management will confirm cost and availability to make sure that you're able to get what you need for discharge. The nurse then, once the care manager has signed off on your discharge, has gotten you any equipment that you may need a walker or crutches, depending on what physical therapy or occupational therapy have recommended. Once that is all set, the nurse will come in and go over your discharge, answer again any more questions that you might have about any of your new meds or any of the dressing changes. The nurse then will let you know that you're all set for discharge. The nurse or case manager will let you know when it's a good time to call your ride so that you're not having your ride sit and wait here for you. We try to work very well close together so that we can provide you all that you need. So hopefully this has been very helpful and you have a good outcome and follow up with your joint procedure.